everybody. I'm Professor Anne Bonner, and even though I'm the head of school of our school, Nursing and Midwifery here at Griffith, I'm also a nephrology nurse and have been a nephrology nurse for longer than I care to admit. So I'm going to talk today a bit about chronic kidney disease for you. The first thing I want you to remember is renal sounds really complex, but it's not. So if you can remember the 7 functions of the kidney, what the kidneys normally are supposed to do, then you can quite easily work out what's going on for people when they have chronic kidney disease. So the functions of the kidney are to maintain water balance, electrolyte balance, acid-base balance, blood pressure balance, removal of waste and toxins such as urea and creatinine and a whole raft of other things, activation of vitamins D3, so that's 1,25-dihydroxycholecalciferol. I love saying that word. And you need that to have good bones. And the kidneys are also responsible for the production and secretion of erythropoietin. So this is first year A&P stuff. So when you have kidney failure, you have signs and symptoms of fluid overload, electrolyte problems, particularly potassium and phosphate, metabolic acidosis, hypertension, uremia, and problems with your bones, which we call chronic kidney disease, mineral bone disease, because you can't absorb calcium from the gut because you haven't made that active form of vitamin D3. It then switches on your parathyroid gland, so you end up with hyperparathyroidism. And all of that is designed to leach calcium out of your bones because you need calcium. And so you end up with renal osteodystrophy. And lastly, because you don't produce and secrete erythropoietin, you're anemic. So chronic kidney disease is slow and insidious. It's irreversible damage to the kidneys. And many patients don't tell us that they've got any symptoms, but if they stop and think about it, they might be more prone to nocturia, nausea and vomiting, headaches, breathlessness, and weight loss. So a key thing you should know is the term eGFR, or estimated glomerular filtration rate. And this is a measurement that's determined on every single blood result that you get from a GP or in hospital. The minute you measure electrolytes, you also are determining somebody's kidney function. And the normal estimated GFR is about 100 mils a minute is considered normal. So what we do know is that there's a lot of people with chronic kidney disease in Australia. There are hundreds of millions of people, hundreds of thousands and millions of people who have chronic kidney disease in Australia. And I'm going to go through a little bit all of these different stages that we have in chronic kidney disease. And it's only the last stage 5, called kidney failure, or what used to be called end-stage kidney disease. So that's an incorrect term to use these days. And that's where someone's kidney function is less than 15, so less than 15%. But it's only a small number of people in Australia who actually are in kidney failure. It's all of these other stages that we have to worry about these days. So it's a bit like the Titanic and the iceberg. Everybody thinks kidney failure is what you see in the dialysis unit, and it's just the tip of the iceberg. It's the underneath part that we have to worry about. So we know that 1/3 or 1 in every 3 Australian adults are at an increased risk of chronic kidney disease. And this is primarily due to diabetes, both type 1 and type 2, but mostly type 2, hypertension, smoking. As you get older, so over 65, Aboriginal and Torres Strait Islanders are more at risk. You're more at risk if you have a family history of kidney disease or if you have obesity. And so 1 in 3 Australian adults are at a very high risk of developing chronic kidney disease. So we need to prevent this from happening. We need to then slow the progression from the various stage 1 through to stage 5. So who has chronic kidney disease in Australia? About 10%, it's closer to 11%, of Australian adults actually do have chronic kidney disease. It is very, very common, and it is more common in older people. So this is some Australian information that shows that everyone thinks it's only those who are on renal replacement therapy, so dialysis, but the vast majority of people, particularly in the older age group, are not on dialysis, but yet they have chronic kidney disease. So what are the signs? It's a silent disease. It can progress over months and years, and most people may not get any symptoms until at least 90% of their kidney function has been lost. So in other words, their eGFR is sitting under 15. So what are these signs and symptoms? And you can see this is a diagram straight from medical surgical textbooks and pathophysiology textbooks, chapters that I write in these textbooks, showing you the whole body systems that are affected just because you have chronic kidney disease. And there isn't one system in the body that isn't affected by having kidney disease.